Breaking news just moments ago, Hillary Clinton taking a brutal shot at the GOP over health care, tweeting, "Forget death panels. If Republicans pass this bill, they're the death party." The death party. Hillary Clinton not mincing words there. Congressman Andy Biggs of Arizona voted against the House version of the health care bill last month, and he joins me now. Congressman, thank you very much for joining us. I'd like to get your thoughts on being part of the death party if this bill goes through.
Thanks for letting me be with you tonight, Charles. But, I mean, that's laughable. The idea of death panels came in because of Obamacare. And then to immediately go when the Republicans are trying to provide more health insurance to more people by somehow, even slightly, lessening how bad the Obamacare bill is itself. I mean, to make that kind of accusation is over the top. Everybody who knows it. That's the reason that the Democrats are in a bit of a spiral themselves. And Hillary Clinton is largely to blame for that, for this kind of rhetoric. This is what killed her campaign.
Apparently she's referencing a report that says if up to 23 million people don't have health care insurance by 2026, doing the math, that will automatically result in at least an additional 28,000 unnecessary deaths in this country. Of course, we know the CBO is going to score this on Monday, and we'll find out what their version of it is. But that seems to be central to what President Trump may have said here recently about the House bill, the one that you did not vote for, by the way, being quote-unquote mean.
Well, you know what the real meanness is, where it's really hard on people, is when they can't afford to get insurance. And Obamacare drove premiums out of the range of most people. So you brought people on through the Medicaid expansion, but you were pushing people off on the backside because they simply couldn't afford health insurance anymore. That's what's outrageous about all of this. And so I don't think it's mean what the Republicans are trying to do. They're trying to fix it. It doesn't go where it should go, but the real problem is that you've got too much government meddling in the health insurance sector.
I don't disagree with that, but now that you've said that, it feels to me that if they do find a way to pass this in the Senate, and it comes back to the House, it's going to put extraordinary pressure on you and your fellow Freedom Caucus members, because I believe that's where they're going to blink. If they blink, it's going to be, longer Medicaid, more government, more taxpayer money, and you guys are going to have to make a stand. Are you prepared to do that?
Well, I won't speak for anybody else but me. And my constituents sent me here to completely repeal Obamacare, not to expand the entitlement programs, not to keep spending taxpayers' money on this type of program. So I would probably have to vote no on it. I've read the Senate bill, and as it sits now, unless there's some major reforms in there that actually simulate repeal, which would drive down premiums, then there's no way I can vote for that.